Good morning, everyone. I am Dr. Harvinder Singh. So, we have this new topic. It's not a new topic, but a new publication or a new article on this chronic issue that we see with our medications. So here I will compare our first line antidepressants with their risk of weight gain. So weight gain is a very tricky topic, as you all know. Weight gain can mean many things. First, it can mean improvement for a patient who was losing weight due to major depression as the root cause, or it can even mean residual atypical depression symptoms persisting, right? But it can also mean other confounding factors that we should never ignore, ranging from diet, exercise, and all those factors, the sedentary lifestyle. So before jumping on to medication as a root cause, we should do all that. But this presentation is not on evaluation. We have chapters on those in the antipsychotic section. But the reason I decided to post this topic is this. Annals of Internal Medicine just published on 2nd of July this year this study. In this study, they actually looked at 8 first-line antidepressants, and they looked at the risk of weight gain with that. But before I, go into the study results, I felt like we should talk about what were prior studies like. What did they showed in terms of the weight gain from antidepressant? There are so many studies on this, but I just want to point the study published in Journal of Clinical Psychiatry in 2010. This was a comprehensive review and meta-analysis of the association of antidepressant and the weight gain associated with that. And what they found is that the greatest weight gain was found with these 3 antidepressants that we know. Like among tricyclic, amitriptyline is the one, mirtazapine is so well known for that, and paroxetine among SSRI. And some weight loss was found with fluoxetine and bupropion. So let's see if the results sustained with this new article. So before I go into the results, I just want to briefly go over the design because there are some important points to know here. Number one, this was like an observational study. They looked at the electronic health record data among 8 United States health system, and these were the number of patients they looked at, around 183,118, and they looked at patients from July of 2010 to December 2019, and the age range from 20 to 80 years old. And the interesting thing is all were first-time users of antidepressant. So for that reason, I feel like this topic is relevant to every medical professional who helps or sees patients with depression, because this data applies to the first-time use of antidepressants. We are not talking about treatment-resistant depression. So be mindful of that. And the medications they looked at were these 8 antidepressants: fluoxetine, paroxetine, sertraline, citalopram, escitalopram, Venlafaxine, Duloxetine, and Bupropion. And they followed patient at 6 months, 12 months, and 24 months mark. And the results were actually compared against sertraline. So sertraline was the benchmark medication because this was the most prescribed antidepressant in this group. I think it was close to 20%. And the exclusion criteria were really important just to rule out those confounding variables, right, that can do weight gain or weight loss. So first, they only looked at patients who were on one antidepressant. More than one were excluded. And patients who were on weight-changing medications like stimulants, steroids, or weight loss medications. And obviously, anyone with recent history of cancer, pregnancy, or bariatric surgery. Now, What did the study found? Now, before I go into that, I'm not going into the mechanism of action, but studies have shown that the impact on histamine 1 and serotonin 2C receptor have postulated to be responsible for the weight gain with the medication. Now, the most important is this. What did they found? So, as I said, they kept sertraline as a benchmark and they compared all the other 7 antidepressant with sertraline. And this is the result at 6 months. So, what was the comparison, the ranking of the antidepressants at 6 months mark? So first is the sertraline, right, which is the benchmark here. So sertraline patient gained at average of 1.5 kilograms. This is not in pounds, so be mindful of that. So 1.5 kilogram weight gain with sertraline at 6 months mark. Now compared to this, the highest weight gain was associated with escitalopram. Now look at this. I hope you can see the marker here. The mean was zero point 0.4. So this is 0.4 plus 1.5. So compared to sertraline, there was 0.4 more weight gain with this escitalopram, but the confidence interval was between 0.3 to 0.5. So this was really interesting finding for me because the most common culprit we think of is paroxetine. Like clinically speaking, we see more with paroxetine. And based on the poll we did in our Academy Facebook group, almost everybody marked paroxetine as the higher likelihood of causing weight gain. But based on this observational study, escitalopram was on top with more than like zero point 0.4 than sertraline. Now, the second medication after escitalopram is paroxetine. Very similar, like 0.3 plus sertraline weight gain increase with the confidence interval between 0.2 and 0.5. Let me see. Okay, perfect. So 0.2 to 0.5 range, almost very similar to the escitalopram. And the third medication was duloxetine among SNRI. Again, 0.3, right? So you can see for these three medication, it was plus 0.3 kilogram weight increase compared to sertraline. The confidence interval was very similar, more for escitalopram. I, I I should not say more, but if you look at the confidence interval, it was almost similar here. Very little bit less for duloxetine. Now, the next medication is venlafaxine. 0.1 increase, 0.1 kilogram increase with this big confidence interval of 0.03 to 0.3. So definitely better than these three here. And then the medicine was citalopram, very similar, but much on a lower side, again, 0.1 again. So these three had plus 0.3 to 0.4 kilogram weight increase. These two have only 0.1 kilogram weight increase. And then the interesting thing is fluoxetine. The weight was almost like similar based on the study. But when you look at, there was some reduction here, 0.07. And when you look at this confidence interval, it was a little bit on the negative side and some weight increase of 0.04. And this is what that other study, the one published in 2010 in Journal of Clinical Psychiatry, was also pointing toward. So this is the ranking you can see, but we are still left with one medicine, which is bupropion. This was the lowest, right? There was a weight loss on bupropion. Like if for fluoxetine, there's 0.07. There was 0.2 kilogram weight loss on bupropion. You can see the confidence interval. Everything is in a negative range here. So this is the reason I made these diagram is so that we can keep this picture in mind when you're choosing one medication over another. So the ranking is like this: Escitalopram, followed by Paroxetine, followed by Duloxetine, followed by Venlafaxine, followed by Citalopram, followed by Sertraline, followed by Fluoxetine, and then Bupropion. We are not talking about those newer medication like Vortioxetine, Vilazodone. The data is better for those medication, but again, we need more, I think, timeline. But this is first line medication, friends. So keep an eye on this. Now, the other thing they found is these first three medications were associated with 10 to 15% higher risk of gaining at least 5% of the at least 5% off baseline weight. So that's a higher risk. These three are the higher one, and as you know, bupropion had 15% reduced risk, so this was the better option here. Now, the other thing I want to emphasize is I have not mentioned that here, but they also looked at adherence, like how much their patients were adherent to these medications. I think at 6 months mark or maybe longer, bupropion had the highest adherence of 40%. Duloxetine, they mentioned close to 20%. Now, be mindful, this data is for 6 months mark. But when they looked at the 12-month to 18-month mark, this was very interesting. They found the SNRI, like Venlafaxine and Duloxetine, weight gain plateaued. But for SSRIs, there, there was continuous increase. But they mentioned that this is likely not reliable due to the non-adherence risk factor. The adherence was a big factor as the time went on. So that's why I'm only focusing on the 6 months mark here, friends. So let me know, like, if you find this presentation helpful. I'm trying my best to make these very short videos, less than 15 minutes, so that you can use this in your clinical practice. You can share your thoughts with me. This is my email, and let me know what is your clinical experience, which medication among these 8 antidepressants you find to be the highest culprit in causing weight gain. And for our academy members, we have a full section on managing antidepressants adverse event. This video will be actually added as a new chapter there. But we have chapters on, managing emotional blunting with antidepressant, managing excessive sweating with antidepressant, managing dry mouth with antidepressant, managing bruxism with antidepressant, and there are a few more chapters. So this is mainly for our academy members. Please go and watch all of them just to stay updated, because these things we see often, right, in our clinical practice. And for interested students, interested medical professionals, if you're interested, do consider joining our academy membership. Go to psychiatryeducationforum.com, learn more about what we are offering. But thanks again for listening to me. You all take care and bye for now. Thank you again.